Florida's healthcare system is about to face its biggest crisis yet, and most people have no idea what's coming. Picture this. You're sitting in a hospital waiting room, and there simply aren't enough nurses to care for everyone who needs help. Sound impossible? Think again. We're about to dive deep into Florida's healthcare landscape, and what we've discovered might shock you. Both the incredible successes and the looming disasters that could reshape how Floridians receive medical care. Welcome to our deep dive into the Sunshine State's healthcare pulse, where policy meets reality and the stakes couldn't be higher. The surprising truth about why Florida dominates end-of-life care. Here's something that might surprise you. Florida isn't just good at healthcare. It's absolutely crushing it in one specific area that most states struggle with. A groundbreaking analysis from Florida Tax Watch has just revealed that the state stands proudly among the nation's top 10 performers when it comes to hospice services, based on the most recent data compilation from the Centers for Medicare and Medicaid Services. But here's where it gets controversial. The secret weapon behind Florida's success is something many healthcare economists argue against: strict government regulation through the Certificate of Need (CON) program. This regulatory framework controls when and where new hospice facilities can open their doors, essentially creating government-managed competition. Critics often slam these programs as anti-free market, but Florida's results tell a compelling counterstory. The state achieved an impressive 6th-place national ranking in the Hospice and Palliative Care Composite Process Measure, scoring 95.9%. Even more remarkable, Florida tied for 2nd place nationally in the overall Hospice Care Index, with a score of 9.7. Dominic Calabro, who leads Florida Tax Watch as president and CEO, emphasizes that palliative care represents more than just end-of-life treatment. This type of care can be integrated much earlier in managing diseases, he explains, creating opportunities to enhance patients' quality of life, while simultaneously reducing financial burdens for both individuals and taxpayers. But here's the part most people miss. Executive Vice President Jeff Kottkamp points out a glaring gap in the system. Despite Florida's stellar performance metrics, adequate palliative care services remain unavailable in more than half of Florida's counties. This paradox raises a critical question. How can a state excel nationally while leaving huge geographic areas underserved? The comprehensive study, titled Hospice and Palliative Care, Florida is a national leader among the states looked to for best practices in compassionate care, reveals an interesting shift in how care is being delivered. The state is experiencing a significant transition toward community-based and home-centered palliative care approaches, which research shows increases patient satisfaction while driving down overall costs. The report's recommendations paint a picture of cautious expansion, strengthening regulatory frameworks to clearly define palliative care services, establishing consistent quality standards, and creating reliable funding mechanisms. Tax Watch specifically advocates for expanding the scope of practice for advanced practice registered nurses, launching Medicaid pilot programs designed to help patients transition into hospice care earlier in their illness trajectory, and maintaining the controversial CON program. And this is where the debate gets heated. Tax Watch warns that eliminating CON oversight could trigger an influx of substandard providers, pointing to documented cases of fraud and market instability in states that have abandoned such regulatory controls. What do you think? Should government regulate healthcare competition to ensure quality, or does that stifle innovation and access? The evidence from Florida suggests regulation works, but does that apply everywhere? The nursing crisis that could cripple Florida's healthcare system. Now let's talk about something that should terrify every Florida resident. The state is barreling toward a nursing shortage so severe it could fundamentally break the healthcare system. The Florida Center for Nursing, operating from the University of South Florida, has just released what might be the most important healthcare report you've never heard of. Their comprehensive Florida Workforce Projections 2022 to 2037 uses sophisticated modeling from global data to forecast healthcare workforce trends, and the results are genuinely alarming. Here's the bombshell. Licensed practical nurses face what experts are calling a supply cliff. The data projects that supply will shrink by nearly 1% every single year, while demand explodes upward by 2.3% annually. To put this in perspective, the adequacy rate, essentially how well supply matches demand, could plummet from 85% in 2022 to a catastrophic 55% by 2037. But here's where it gets controversial. Is this crisis inevitable, or is it the result of systematic underinvestment in nursing education and poor working conditions that drive people away from the profession? Registered nurses appear to be in better shape on paper, with projections showing they'll maintain approximately 93% adequacy statewide. However, this statewide average masks significant regional disparities that could leave entire communities without adequate nursing coverage. Certified nursing assistants face a particularly dramatic reversal of fortune. The projections show this workforce category swinging from having a surplus to experiencing severe deficits, with statewide shortages potentially beginning as early as 2026 and becoming critical by 2037. Raina Letourneau, who serves as the Florida Center for Nursing's executive director, emphasizes that raw numbers only tell part of the story. The statistics might indicate near balance for certain healthcare professions, she notes, but the geographic distribution reveals a completely different reality. Understanding these regional variations is absolutely crucial for maintaining and strengthening our healthcare workforce throughout every corner of Florida. Husha Menon, Senior Associate Vice President at USF Health and Dean of the USF College of Nursing, sees this data as a roadmap for action. Having this knowledge empowers us to design our educational programs strategically, targeting the most urgent needs across our state. Considering Florida's explosive population growth and rapidly aging demographics, these workforce projections become even more critical for shaping future education, training, and recruitment strategies. But here's the question nobody wants to ask. Are we willing to pay what it takes to solve this crisis? Higher wages, better working conditions, and expanded education programs all cost money. Who should pay? Hospitals, taxpayers, or patients? Breaking healthcare news you might have missed. AdventHealth is making a major expansion move that could reshape healthcare access in Central Florida. According to reporting by Sarah Murley of the Apopka Chief, the healthcare giant is constructing a new emergency room facility at Wild Oaks, strategically positioned at the intersection of State Road 429's Exit 38 and West Kelly Park Road. The location choice is particularly interesting. It sits adjacent to both a public park and nature preserve, suggesting a focus on community integration. The partnership announcement came during the ICSC at Florida Conference, an influential gathering of mixed-use development industry leaders. Wild Oaks founder Joseph Beninati revealed that official paperwork was executed on August 22nd. In a candid interview, Beninati hinted at potential future expansion, noting that the advanced ER at Wild Oaks may eventually grow into a full hospital during later development phases. What's particularly intriguing about this partnership is the alignment of values Beninati described. AdventHealth appealed to us because we share fundamental values, including a strong conservative financial approach. This suggests a business model focused on sustainable growth rather than rapid expansion. AdventHealth's impressive portfolio includes 17 hospitals and freestanding emergency rooms, plus hundreds of outpatient care centers throughout the region. The organization's credibility gets a significant boost from U.S. News World Report's ranking of AdventHealth Orlando as Florida's #1 hospital and among the nation's top 20 medical facilities. Meanwhile, Tampa General Hospital's Transplant Institute has achieved something truly remarkable, claiming the title of America's highest volume organ transplant center. According to Chicago Business Journal reporting, the institute performed an astounding 889 transplants in 2024, earning top national ranking by volume, according to Organ Procurement and Transplantation Network data. What makes Tampa General particularly unique is its comprehensive transplant capability. The hospital performs adult kidney, liver, heart, lung, and pancreas transplants, plus pediatric kidney transplants, making it one of only a handful of U.S. hospitals offering all 5 adult solid organ transplant types. Here's why volume matters more than you might think. In transplant medicine, the number of procedures directly correlates with success rates. Higher volumes create opportunities for surgical teams to refine their expertise with every single procedure. At Tampa General, this translates into measurably shorter patient wait times, improved survival rates, and ultimately, more lives saved. Regulatory updates that could impact your healthcare. Several important regulatory changes are taking effect that could influence how healthcare is delivered in Florida. A newly proposed regulation, 59A 3.246, establishing requirements for licensed programs operating within hospitals, was officially published on September 8. This rule could affect how certain medical services are structured and delivered in hospital settings. The Department of Health Board of Chiropractic Medicine has finalized new rules regarding application procedures for licensure endorsement, with these changes becoming effective September 15th. This could impact how chiropractors licensed in other states can begin practicing in Florida. Additionally, the Department of Health Board of Opticianry has implemented updated rules concerning apprenticeship requirements and training programs, effective September 9th. These changes may influence how future opticians receive their training and enter the profession. Celebrating healthcare leaders. Several Florida healthcare policy leaders have birthdays coming up. Representative Mike Caruso celebrates on September 15th. Senator Jennifer Bradley's birthday falls on September 22nd, and Representative Michelle Rayner celebrates on September 25th. So here's the big question for discussion. Looking at Florida's healthcare landscape, from hospice care success to nursing shortages to major hospital expansions, do you think the state is heading in the right direction? Are government regulations like the CON program helping or hurting? And most importantly, what would you be willing to sacrifice or pay to ensure adequate health care for all Floridians? Share your thoughts below. This affects every single one of us, and your perspective matters in shaping the future of healthcare policy.